Hey, I'm Ralph Tufano. I'm a head and neck endocrine surgeon. I spent my first 20 years of my career at Johns Hopkins Hospital and just moved down to Sarasota, Florida in August of this year.
I'm Mark Lupo. I'm an endocrinologist with a thyroid-only practice. I've been in Sarasota for 19 years. My practice is limited to thyroid nodule evaluation and thyroid cancer.
What is it about this partnership between the two of you that makes this practice so special and unique?
When we sit down and we talk about what we can do for the patient's at the center. What are all the possible options for management of this patient? Surgical versus non-surgical. And then we present that to the patient, we educate them about it, and then they can make the value-based decision about what's best for them.
The exciting part about collaborating with a surgeon for us is, as endocrinologists, we typically see the patients more than the surgeons do. So to have someone we can trust to refer to, that we can have a good dialogue on different options for patients, a collaboration and relationship where we can, in good faith, send a patient to a surgeon that I trust what will happen. And sometimes what's been happening is I send a patient to a surgeon for an opinion, and the next thing I know, they're signed up for surgery. And so when I refer to someone like Dr. Tufano, I tell the patient, this isn't signing you up for procedure, this is signing you up for a discussion, and together we'll decide what's best for you. Yeah, I think the patient experience needs to include efficiency. I mean, so often I see patients who have made 3, 4, 5 stops to different radiologists, specialists, and they wait weeks for results. So our goal is to cut that down to a few days at the most, and then be able to present options all within a matter of 2 visits.
So in this center, you're going to be able to get every possible option for your management and your care. We provide everything from the time of your initial evaluation to even all the possible surgical options. This is unlike any other center in the United States where you have an endocrinologist and a surgeon working together to discuss all of your options right then and there.
One aspect of what makes this partnership so special and unique is Thyroid RFA.
You know, what's very exciting is the prospect of doing something that is non-surgical. And so patients have thyroid nodules. Dr. Lupo, when he'll do his biopsy and say, hey, this is a benign process, but yet it's bothering the patient. They don't like the appearance, or maybe it's pushing on their windpipe, or they feel it when they swallow. Before, we had to think about doing surgery, and surgery comes, no matter how experienced you are, with a set of risks. And then most concerning is obviously the need for having to take thyroid hormone. RFA allows you a directed procedure to just treat the thyroid nodule alone, with the hope that you probably will not need thyroid hormone. So if you can do this, shrink that nodule, and have an alleviation of all those symptoms, and they don't need thyroid hormone, then you really won the game.
For the right patient, it's a great procedure to offer. As an endocrinologist who does thyroid hormone replacement, they do much better if they have their own source of thyroid hormone than a tablet every day. From a wellness standpoint, long-term is very important. And we see lots of benign nodules, but sometimes they grow. And when they grow, they wear out their welcome. So it's nice to have options besides removing it surgically.
Absolutely, that was a big driving factor for me.
Right.
I didn't want to have surgery.
Right.
I didn't want to be on medication.
Correct.
In preparation for radiofrequency ablation of a benign thyroid nodule, typically we'll have the patient a little bit flatter. We'll explain to them that once we start the treatment process, they may feel and experience some funny things. Sometimes they'll hear some popping sounds, and it sounds like popcorn popping, and that's the actual heating of the nodule and some escaping of the gas from that area. But I tell them their thyroid's not going to explode, that it actually means that the technology is working, that it is working to shrink the nodule. Sometimes you may get a little ear pain that's referred, or you may get a little jaw pain. If we dial down the energy or stop for a little bit, maybe give a little bit more lidocaine, because that's what we use to numb the area, they may feel a little bit better. Then we prepare the area and sterilize it with a sterilizing solution. Then we inject lidocaine, which is like a Novocaine when you go to the dentist's office. And then once we're able to get our area anesthetized, by the ultrasound, we follow our needle to our target, and then we start delivering the energy to heat up that nodule and start the ablation process. We consider ourselves a sort of one-stop shop. So you're going to have your follow-up here with ultrasound. Fortunately, we have Dr. Lupo and his expertise in ultrasound to help characterize what these nodules look like, and that's important educationally too, to teach people, what these nodules look like after treatment, so you don't get scared about the changes that happen.
I always tell patients after any sort of ablative procedure that the nodule characteristics change. The future doctor doesn't know that. They're going to be getting the biopsy needle out, so it's important for patients to be educated on the post-ablation changes that we see.
We follow the patient up and see how much the volume reduces for the thyroid nodule, and so see the effect of our RFA treatment.
So it's very important as a specialist to be able to communicate with other endocrinologists or with primary care doctors so that we make sure that the patient follow-up is appropriate. So we want doctors to have the confidence referring to a unique integrative center like ours, but then also we need to make sure the follow-up, if it's not done locally, is done properly. So we would give specific milestones and instructions on how that's done, and the ability for them to call us and troubleshoot anything that's happening.
We want these doctors that are not trained in RFA to be intrigued by it. We don't want them to be afraid of it. What about your training of physicians here?
We are looking forward to conducting courses on RFA training and also educating physicians on the contemporary management of thyroid nodules and thyroid cancer. We're excited about that.
Absolutely. Yeah, the best courses are always the collaborative courses when you have surgery represented, endocrinology, pathology, where everyone can share their expertise and have case example discussions. So we can certainly do that here.
We cover everything, and one of the things that we had talked about is from soup to nuts. There's not one thing that we don't offer here at the center. And with the expertise from the beginning in thinking about the patient at the center, that's the value of it to the patient. Why would you go elsewhere? Why? And I would say, why would you just go to a surgeon, even at Hopkins or a Mayo or just an endocrinologist? I want you two to be talking together about me. So tell me as a team what you can do for me. Like, it doesn't get any better than that. We've overcome so many boundaries, challenges, and hurdles. In academic medicine, you can't even do this, right? This is pretty remarkable. We fought so hard and long to make this happen. These discussions have been happening for about 10 years. Only over the last couple of years did we really say, let's really try to make this happen. Try not to compromise. I don't think we really compromised at all.
No,
because we had the patient at the center of what we were
if you keep the patient at the center, everything else falls into place.
If I'm a patient coming to your clinic, and I know that I can come in here and I can get my ultrasound and my biopsy and my potential surgery or my RFA treatment and then follow up all in one place, that shortens the length of time that I have to go from not knowing to being done with this. Ordinarily, that is a process that takes months.
Right.
And that's anxiety provoking. It's a whole amount of headache that you're eliminating for the patient.
It's coordinated care under one roof. From the time you walk in here for the first time to the time we say goodbye, you don't need us anymore. That's amazing.
It's amazing that as doctors you can understand, you can identify with the patient that
and
way.
we take it for granted because that's what we do all the time. We're patient-centric. Then you hear all these stories about very non-patient-centric experiences that take months and a lot of anxiety. So that's unnecessary.
And if that doesn't excite you enough, the Sarasota sunsets and the water and the beaches are pretty amazing.